Burn injuries don't end with wound closure. Scars shape how patients move, feel, and live. Physical therapy focuses on scar management using pressure, massage, exercise, and skincare to keep scars flat and pliable. This ensures independence, restores confidence, and improves quality of life. Scar management is not cosmetic, it is essential rehabilitation. And today, we will discuss PT perspective on scar management and burn rehabilitation. A scar in the body's natural repair tissue. When normal skin is injured, it's replaced by fibrous tissue that often looks and feels different. Scars may be raised or depressed, with irregular texture and contour. Over time, they can change depending on inflammation, collagen production, and the tension around the wound. Understanding these factors help us guide scar management and burn rehabilitation, ensuring better healing and function. So what exactly is a scar? A scar is a fibrous tissue that replaces normal skin after an injury. It is part of the body's natural wound healing process. Scars can look very different, sometimes flat, sometimes raised, firm, or even discolored. Physiologically, scars form because collagen fibers are laid down quickly, but in a disorganized way. This makes the tissue less elastic than normal skin. And as a result, scars can affect not only appearance, but also sensation, temperature regulation, and even movement. Understanding these changes is crucial in burn rehabilitation because it helps us design therapies that improve both function and quality of life. Burn scars can take different forms, and each type affects recovery in unique ways. Now let us look more closely at the three main types: hypertrophic scars, contracture scars, and keloid scars, to understand their impact and how therapy addresses them. Hypertrophic scars are one of the most common outcomes after burn injuries. They form when the body produces excess collagen during healing. But unlike keloids, they remain confined to the original burn site. These scars are usually raised, red, thick, and can feel firm or itchy. While they can be uncomfortable, the good news is they often improve naturally over time. In rehabilitation, we manage them with pressure garments, silicone gel sheets, massage, and regular moisturization. These interventions help soften the tissue, reduce thickness, and improve both comfort and mobility. Contracture scars occur when the skin and underlying tissue tighten during healing. This pulling effect restricts movement, especially across joints like the neck, elbows, knees, and hands. They often appear tight, shiny, and restrictive, and are most common after deep burns or grafts. The impact can be significant, limiting mobility and interfering with daily activities. That is why management focuses on stretching, splinting, and active range of motion exercises to keep joints functional. In more severe cases, surgical release or grafting may be needed. Keloid scars are thick, raised scars that extend beyond the edges of the original wound. They form due to excessive collagen production and are often influenced by genetic factors, making them more common in individuals with darker skin tones. These scars can be painful, itchy, and cosmetically distressing, and unlike hypertrophic scars, they don't regress naturally. Management may include corticosteroid injections, laser therapy, cryotherapy, or even surgical removal, though recurrence is common. Preventive care, such as silicone sheets or pressure therapy, is also important. Scars matter because they affect both function and psychosocial well-being. Functionally, scars can tighten skin and tissue, limiting range of motion. They often bring pain, itching, and stiffness, which interfere with daily activities like dressing, bathing, or even working. Physical therapy addresses these challenges through stretching, strengthening, and mobility training to restore independence. But scars also carry a psychosocial impact. Their visibility can affect body image, confidence, and social interaction. Many patients struggle with anxiety or depression linked to their scars. Rehabilitation isn't just physical, it empowers patients, helping them rebuild confidence and reintegrate into community and work life. That is why scar management is central to burn care in PT.
The Vancouver Scar Scale is one of the most widely used tools to evaluate burn scars. It measures 4 key parameters: pigmentation, vascularity, pliability, and height. Each category is scored and the total range from 0, which represents normal skin, up to 13, indicating the most severe scarring. For example, pigmentation looks at color changes. Vascularity reflects redness or purpling. Pliability assesses how flexible or firm the scar tissue is, and height measures how raised the scar appears. By combining these scores, clinicians can track scar progression over time and guide treatment decisions. This scale is essential in rehabilitation because it provides an objective way to measure improvement and tailor interventions for each patient. Developed in 1990, the Vancouver Scar Scale Burn Scar Index is the first widely used tool to assess burn scars. It's semi-quantitative, meaning it scores scars across 4 categories: vascularity, pigmentation, pliability, and height. Each category is rated and the total scores range from 0, normal skin, up to 15, representing severe scarring. This scale matters because scars affect movement, function, and even mental health. By tracking scores over time, clinicians can monitor how scars mature and evaluate the effectiveness of treatments like compression therapy, silicone sheeting, or surgery. In rehabilitation, the VSS provides an objective way to measure progress and guide interventions, ensuring care is both consistent and patient-centered. Scar management is most effective when started early. In the first 3 to 6 months, scars often become raised, firm, and red due to excess collagen and blood vessel activity. If left unchecked, these changes can lead to long-term complications. That's why therapy emphasizes positioning and stretching, because the position of comfort often becomes the position of contracture. Splinting helps counter tightening force, while compression garments reduce thickness, hardness, and redness. Scar softening techniques like massage, silicone, and moisturizers further improve tissue quality. The key principle is simple: early consistent intervention prevents contractures and supports better healing outcomes. Pressure therapy is the standard treatment for raised, thick scars such as hypertrophic scars and keloids. It works by applying sustained, uniform compression to scar tissue, helping flatten scars, reduce redness, decrease itching, and improve overall comfort. The benefits are clear. Scars become softer, thinner and less noticeable, while pliability improves, making movement easier. For best results, garments must provide continuous pressure of 15 to 25 mmHg, worn about 23 hours a day. Starting within 2 months after wound closure, therapy usually continues for 12 to 24 months until the scar matures. Consistency is the key. Adherence to pressure therapy ensures optimal outcomes and long-term improvement in both function and appearance. Pressure therapy can be applied in different ways. The most common are pressure garments, which provide uniform compression, and pressure dressings, which are used for more localized areas. Let's explore how each technique supports scars management. Pressure garments are one of the most important tools in scar management. These elastic compression garments, usually made of spandex or lycra, are custom fitted to the arms, legs, torso, hands, feet, or even the head. Their purpose is to provide uniform pressure across the scarred area, helping flatten scars, reduce redness, and improve pliability. The benefits are clear. With consistent use, scars become softer, thinner, and less noticeable, while stiffness and discomfort are reduced. But there are challenges too. Wearing garments for long periods can cause heat and discomfort. And adherence is often difficult, especially for children. That's why patient education and support are critical. Clinically, these garments are worn about 23 hours a day for 12 to 24 months. Until the scar matures, they must be replaced every 2 to 3 months to maintain proper tension, and regular checks are needed to prevent skin breakdown. Despite the demands, pressure garments remain of the most effective long-term strategies for improving both function and appearance after burns.
What the dog doing?
Pressure dressings are elastic compression bandages used to apply uniform pressure over healing or scarred areas. They can apply in different ways: figure 8 wrapping for the legs, spiral wrapping for the arms, and circular wrapping for the trunk. For smaller areas like hands, fingers, and toes, self-adherent bandages are ideal, while tubular support bandages are often used for children. The benefits of significant pressure dressings help reduce edema and scar thickness, promote even pressure distribution, and provide comfort. They are especially useful as an interim measure before custom garments are fitted. However, there are challenges. Dressing requires frequent wrapping or replacement, and if applied poorly, they can cause uneven pressure or skin irritation. Clinically, pressure dressings are used early in rehabilitation before custom garments are ready. They must be re-wrapped regularly to maintain consistent compression, and skin integrity should always be monitored to prevent breakdown or constriction. Adjustments are made depending on limb size, scar location, and patient comfort.
What the dog doing?
Beyond pressure therapy, physical therapists also use adjunctive intervention to support recovery. Techniques like camouflage makeup, scar massage, and inserts or elastomers each play a role in improving comfort, appearance, and patient confidence. Let's take a closer look at how these methods complement scar management.
Camouflage makeup is a specialized cosmetic technique designed to conceal visible scars and discoloration. It's most often applied to areas like the face, neck, and hands, where scars are most noticeable. The makeup provides a opaque, waterproof coverage that lasts throughout the day, using color-correcting pigments to blend scars with the surrounding skin tone. The benefits goes beyond appearance. It enhances confidence, self-image, and comfort in social settings, helping patients reintegrate more easily. Of course, there are challenges. Proper color matching and technique are needed for natural results, and reapplication or skincare maintenance may be required. Clinically, camouflage makeup is introduced after wound closure and scar stabilization, using hypoallergenic products to avoid irritation. Scar massage is a manual therapy technique performed on healed scars to soften tissue, improve mobility, and reduce discomfort. It can be applied to scars on the face, neck, limbs, or trunk. The benefits are significant. Massage increases pliability and elasticity, reduces pain, itching, and hypersensitivity, and promotes circulation and lymphatic drainage. It also helps break down adhesion, which improves mobility and function. Clinically, scar massage begins once the wound is fully closed and stable. Therapists use percircular and longitudinal strokes, often combined with moisturizers or silicone products to reduce dryness and friction. Patients and families are taught to perform massage several times daily, and it is integrated with stretching and exercise for maximum functional gain. Inserts and elastomers are specialized tools used in scar management. This includes silicone gel sheets or moldable elastomer putty inserts placed under garments to target localized, stubborn raised scars that garments alone cannot flatten. They are most effective for immature scars, usually about 3 weeks of healing, and are applied directly over maturing tissues. They provide focused compression, hydrate and soften scar tissue, and reduce itching and discomfort. However, challenges include the risk of reversible rash, the need for regular adjustment, and ensuring patient compliance. Clinically, inserts and elastomers are used in combination with garments or masks, and carefully monitoring is required to prevent skin irritation. They are especially valuable for scars with uneven thickness, offering a more tailored approach to scar control. Scar management doesn't end with initial treatment. Follow-up care is just as important. Exercise helps restore mobility, splinting and pressure maintain alignment and control scar growth, while proper skincare keeps tissue healthy. Together, these strategies ensure long-term recovery and independence. Exercise is a cornerstone of burn rehabilitation. Its purpose is to maintain range of motion, strength, and function while preventing contractures. The principle is simple. Begin early, even before hospital discharge, and continue with a home exercise program afterward. Range of motion exercises are performed frequently to counter scar contraction, often combined with scar massage to soften tissue. Patients are encouraged to practice daily activities independently, reinforcing functional recovery. Therapists may even record exercise routines to guide families and outpatient care. The key reminder is that position of comfort quickly becomes the position of contracture. Burned skin contracts within hours, not days, so optimal positioning, stretching, and splinting are essential to prevent deformity and preserve mobility. Splinting and pressure therapy are essential components of burn rehabilitation. Their purpose is to prevent contractures and deformities, maintain joint alignment, and support graft healing by immobilizing affected areas. When combined with pressure therapy, they also enhance scar flattening and softening. The principle is to begin early. Joints are positioned in anti-contracture alignment, extension, abduction, or neutral to counter scar contraction. At the same time, uniform pressure is applied through garments, wraps, or inserts to reduce hypertrophy. Both splints and pressure device must be custom fitted and regularly adjusted to ensure effectiveness and comfort. Clinically, splints are introduced about 5 to 7 days after grafting to protect healing tissues. Pressure garments or dressings are worn 23 hours a day for 12 to 24 months, providing continuous compression to flatten scar. The combination of splinting and pressure therapy maximizes scar control while preserving range of motion. Regular monitoring is critical. Therapists assess fit, skin integrity, and patient comfort to prevent complications. Together, splinting and pressure therapy form a powerful strategy to maintain function and improve long-term outcomes in burn rehabilitation. Skincare is a vital part of burn rehabilitation. Its purpose is to protect fragile healing skin, maintain hydration and elasticity, and reduce itching, dryness, and discomfort. Good skincare also supports long-term scar maturation and patient comfort. The principles are straightforward. Use mild, fragrance-free cleansers to avoid irritation, apply non-comedogenic moisturizers regularly, and protect scars from sun exposure with sunscreen of at least SPF 30. Patients should avoid scratching or harsh rubbing, and skincare should be integrated with other therapies like pressure, massage, and exercise. Clinically, this means establishing a daily routine of gentle washing, moisturizing, and sunscreen application. Each can be managed with emollients, antihistamine creams, or cooling techniques, while therapists monitor skin integrity and hydration to ensure tolerance. Overall, consistent skincare is the foundation that keeps scar healthy and maximizes the benefits of all other rehabilitation strategies. The key takeaways in scar management emphasize early intervention, daily consistency, and integration of both physical and psychosocial care. Starting treatment as soon as wounds are closed and maintaining routines of pressure therapy, massage, exercise, and skincare are essential. This holistic approach preserves range of motion and strength, enabling independence in daily activities. At the same time, it improves scar appearance and comfort, restoring confidence and supporting reintegration into community life. Ultimately, effective scar management reduces pain, stiffness, and itching while enhancing mobility, self-esteem, and overall quality of life.
What the dog?